So what are some determinants of adherence to a treatment plan? Definitely the complexity of the diabetes regimen. How difficult is this? How many changes is she going to have to make with this? Barriers to care. What are other issues that are posing challenges to her taking care of her diabetes? What have past experiences shown her? Has she done diets before and they've not been effective, and she's really questioning whether she can follow through with this? The clinician's communication style. How, as a provider, are you talking with her? Are you cutting her off, talking over her, disagreeing? It's really important to ask permission to make suggestions. Try to be collaborative as opposed to confrontational, because you want to, again, develop an equal communication, an equal relationship here, as opposed to more of a hierarchical relationship. Uncertainty or ambivalence to change. Change is scary for anybody. Any level of change is going to be uncomfortable. So I would suspect that most of your patients are going to have some level of uncertainty. Cultural specific differences. Again, how are these affecting their ability to self-manage their diabetes? We just had Ramadan, or finished Ramadan about a month or two ago, and this definitely poses a challenge for our Muslim patients who have to fast during the day. Are they excused from fasting because they're pregnant, or is this something they are participating in, and the dietitian is having to shift their meal plan to night as opposed to day? Again, looking at the quality of support they have and self-efficacy. Do they really believe that the changes they're making, are they capable of making those changes? Do they believe that they can do it? Other factors that impede program participation is their readiness, and we're going to talk about this through the stages of change. Is where is she in her willingness to make these changes? What's her feelings about her self-worth? Can she do this? Does she have family and friends who are supporting her ability to take care of herself? Again, we hear inadequate support definitely can be a factor in causing challenges to diabetes self-management. Resistance to receiving help. She wants to do it all on her own. I don't need help from you. I can do this. Overall health. Does she have other competing health challenges? We know diabetes is a metabolic disease. Does she have high blood pressure, high cholesterol? Does she have a cardiac issue that's also causing challenges with her health? That diabetes is only one part of it, and how is she taking care of these other aspects of her health? Again, socioeconomic status. Finances are a big part of this, because can she even afford to come to these appointments? Can she afford to take off time from work? Can she afford the testing equipment, the food that you're asking her, encouraging her to eat? Work. I had a patient recently who was a housekeeper at a hotel, where every time she asked to take time off to have her snack, she noticed her employer started developing a trend of asking her to work less and less. Obviously, we know this is discrimination, and importance of telling her about the American Disability Act, about reasonable accommodations offered at employer sites, but she couldn't prove this, and it was causing a big stress for her to take off time to come to the visits, as well as to take time to take care of her diabetes. Child care conflicts. Their children, even though they're pregnant, their current children are going to pose challenges, because they're first and foremost in their mind. They want to take care of them, and if their child is having any other issues, or it's difficult to come to these appointments because they can't come because they have a child, this has to be looked at, and how this is going to affect their ability to participate in the program. And again, cultural guidelines and how this interferes with not only their meal plan, but if their values and beliefs conflict with what we're trying to teach them. So now we're going to talk about how do you deal with these barriers. Solution-focused therapy and motivational interviewing are both cognitive behavior approaches that elicit behavior change. And Cynthia, I think we have a question here.
Yes, we do. Okay, do you use solution-focused therapy, I'm sorry for the typo, or motivational interviewing in your practice? Yes, no, or not applicable? So 64% are using either the solution-focused therapy or motivational interviewing, 17% are not using either, and 19% it's not applicable.
Okay. So I'm glad to hear that the majority of you are using solution-focused therapy and motivational interviewing, because I think these are great tools to help with any behavior change that you want for your patient. So as most of you know, motivational interviewing is very client-centered. It starts with where she is. It's directive as opposed to dictating a plan. You're guiding her in this process. It's a method of language. It's how you're talking with her. It's going to empower her to make these changes on her own, to instill motivation and confidence within her. And as we talked about, change is normal. It's going to help explore why these changes are uncomfortable and how you can overcome them. Let's see. So the common principles of motivational interviewing are expressing empathy, develop discrepancy, avoid argumentation, roll with resistance, and support self-efficacy. So expressing empathy is really understanding where she's coming from, not using it, withholding from judgment or arguing or, well, let me tell you another point. Is really just understanding her life experience and where she is and how she's coping with this diagnosis and treatment plan. Reflective listening shows that you are listening and you are understanding, and this is very, very important, especially in the engagement process during your first couple of sessions with your client. It shows that you respect her, you understand where she's coming from, and this instills self-esteem within your client so that she knows that you believe in her and that she has the ability to do this when she goes home. You want to listen with presence. You want to be using not only your ears, but showing in your eyes that you understand. And I use the word heart because when you express that you understood her, you're showing a sentiment of positive regard. Avoiding non-judgmental comments, really curious, asking more open-ended questions. Tell me more about that. That's so interesting. I had a client who is, I think, on her 7th pregnancy and third pregnancy with us with gestational diabetes, and she's Hmong, and she was explaining how their postpartum ritual of being at home and the foods they eat, not leaving the home, their customs, and I just was really, I found it very fascinating, not only because I thought, first of all, what a great way to be supported when you have a baby, not having to go out and taking care of all your other children to school, but also that she really felt that it made a difference for her. And she continued to want to tell me more about her custom because I continue to ask more questions. Silence is really hard for us, and one of the nurses I work with really struggles with this because she feels that if she doesn't talk or offer advice, she's not being of value. Silence is so helpful, and it's something that's so hard to do. But by giving the patient the opportunity to talk and share what she's done, it's again helping her come up with those ideas and to overcome her challenges. Developing discrepancy. Motivation is increased when discrepancies between behaviors and goals are heightened. So our dietitian does a really good job of this, of looking at the food logs of what the mother brings in and then what her blood sugar values are. And okay, I see you want to have blood sugar control. What do you know about blood sugar control? What does that? What helps? Well, I see the food choices you're making and the effects on your blood sugars. Really just developing some discrepancy here between her behaviors, her goals, will help heighten her awareness. Explore the pros and cons of following through with this diabetes plan. What are some of the advantages of eating, following this meal plan versus, or eating the way you eat versus making changes that we're suggesting today? What are some of the main things you don't like about checking your blood sugars? On the other hand, what do you get from checking your blood sugars? Well, you get information. It's not a score. It's not that you're doing good or bad. It's giving us information so we can best help you with your blood sugar control and ultimately a healthy baby. Avoid arguing. This can be very difficult, especially with some of our clients who come in with who are already ready to argue. It leads in us versus them. We really want to, we are on the same team. We all have the same goal of helping you have a healthy baby. Resistance, roll with it. It's going to happen. It's arguing, challenging, discounting, interrupting, cutting off. This is, again, going to create an us versus them. It's really important to roll with the resistance. Minimize it by, again, using the reflective listening, maybe stopping and trying to push your treatment plan and just really stopping. Let's talk about where you are right now. And, okay, I understand this is difficult. Have you thought about trying this meal plan? Or what about checking your blood sugars at this time of the day? Would that work for you? Try to reshift her thinking and reframe it into more of a positive approach. And again, instilling that it is ultimately her choice. When she leaves, it's really about what she chooses to do. This is supporting self-efficacy is very important because we want our clients to feel confident that they have the ability to make these changes. We know this is hard. We're asking them to create a pattern or a habit basically today, and we know patterns don't really, or habits don't really start overnight, but we're asking her to make some pretty big changes. We want to instill the confidence that she can do these things, that we believe that she can do these things, and ultimately, again, it's her choice. It's her responsibility. So the stages of change, I really like this model because it really helps us understand where she is. We're not dichotomizing her that she's either compliant or non-compliant, but that she's on a spectrum of change. And I think this helps us to avoid feeling judgmental and feeling frustrated and resentment towards our clients because we know that that we could possibly be seeing some change. So let's go over these changes, or excuse me, stages. Pre-contemplation. I don't have diabetes. I'm only here because my doctor is making me come. I don't think I have a problem. You're seeing active resistance not only in what she's saying, in her body language, may not even be coming to appointments. I don't have a problem. Contemplation. Okay, I'm willing to listen. I'm here. I'm going to weigh the pros and cons of what you're telling me. Let's hear what you've got to say. And I might try the meal plan. I might check my blood sugars, but I'm certainly not committing to this plan yet. Preparation. Okay, I'm feeling a little bit of excitement about this. I understand that change does need to be made. I'm seeing that my blood sugars are improving with the changes I've made. I'm willing to start making some specific goals with you, with my meal plan, with checking my blood sugars, with coming to my appointments. I will start checking the blood sugars. I've got all my equipment. I've got a plan as to how I'm going to be checking and how that's going to work at home. Action. She's coming to appointments and she's actively participating in the plan. You have some great food logs. She's writing down everything she's eating. You're seeing those blood sugars. You're seeing impacts in the blood sugars, that they're within range, or the occasional highs, but we know that why she had an occasional high value. She can describe in detail what's going on. I know that when I eat cold cereal in the morning as opposed to at night, I can handle it better at night as opposed to the morning. She may have a couple of slips, but again, she's committed to facing these obstacles and gets back on the plan. Maintenance, again, you're seeing her continually actively participating in the plan. Again, has a couple of slips, but we normalize this because we know that we don't expect perfection. They are continuing to be aware of the changes and how the benefits are improving their baby's health, as well as how they're feeling physically. Relapse is normal. It is part of this, and obviously there's an opportunity to learn what came of the relapse. Tell me more. Tell me what happened when you fell off your meal plan, or when you stopped checking your blood sugars. Well, it just, kind of catapulted. I started with pancakes in the morning, and I felt kind of tired, took a nap, forgot to check my blood sugar after breakfast. I wasn't hungry at lunch and skipped it. And then I thought, you know what, it's probably high. I'm not going to check. I'm going to go out to eat with my family. And this, I learned that if I don't just stick with it, this definitely can catapult into other problems. So again, this is an opportunity for her to learn.